Hi Blood Talk fams! One of the hot topic in health and medicine right now is COVID-19 vaccines. Today, I will give some of the highlights of this vaccine, such as what type of vaccines the COVID-19 vaccine is, how often do we need to get vaccinated, the side effect of this vaccine. I will do my best to give you the up and downs, the in and out of these vaccines, given the limited data we have so far. Without further ado, let us get into my journey as a vaccine, COVID-19 edition. There are currently 19 COVID vaccines that are providing for Americans across the country under emergency use authorization. The vaccines are mRNA vaccines. mRNA vaccine is a new type of vaccines. Instead of introducing our body with pathogen antigen, the mRNA provides us with genetic material that codes for spike proteins in a membrane. Once it enters the muscle cells, our ribosome makes the spike proteins. This protein is able to activate our immune system. The two vaccines that we will be talking about it in this video are Pfizer-BioNTech and Moderna. Just to keep things simple, I will refer to COVID-19 vaccines from Pfizer-BioNTech as Pfizer. These two vaccines are similar, but there are some differences that worth mentioning. I will give you some comparisons in storage temperature, preparations, administrations, benefit, and side effect. Storage. For Pfizer, the vaccine needs to be stored and shipped at -94 Fahrenheit. It may be kept at 4 degrees Celsius for up to 5 days. And the vaccines must be used between 30 minutes to 2 hours once it's reached room temperature. For Moderna, it can be stored and shipped at -4 degrees Fahrenheit, may be stored in standard freezer for up to 6 months, and it may be kept at 2 to 8 degrees Celsius for up to 30 days. And it must be used within 12 hours once it's reached room temperature. So you can see that there are some differences in the storage requirements between the two vaccines. Preparations. For Pfizer, the vaccines must be first diluted with saline, which is basically salty water. This step is not uncommon for the vaccines, so it's not a huge burden for the healthcare provider to perform this step. However, for the Moderna, there's no dilution needed, which is very convenient. Administrations. For Pfizer, must be 16 years old or older, and a second dose required after 21 days. And the vaccine is given to you as an injection into muscles or intramuscular. For Moderna, the individual has to be at least 18 years old or older. The second dose required after 28 days, and the injection is also intramuscular. So if you are receiving the vaccines, just keep in mind which vaccines you are getting because one is require second dose after 21 days, another one is 28 days. Benefit of getting a COVID-19 vaccine. COVID-19 vaccination will help keep you from getting COVID-19. However, it is not a guarantee way that once you get the vaccines, you will not get sick. Vaccine is a safer way to build up your protections than getting the infections. The vaccine is an important tool to help stop the spread of this pandemic. As the manufacturer is able to produce more vaccines, more people will have access to this. What is the recommendations for vaccinated people when going outside? Given the current limitations on how much the mRNA vaccines may reduce transmissions and how long the protection will last, vaccinated persons should continue to follow all the current recommendations and guidelines. This includes wearing masks and facial cover when going outside, staying at least 6 feet apart, and avoiding crowds and wash your hands often. This is to help protect yourself and also those that do not have the access to the vaccines at the moment. Side effects. For Pfizer, the most common side effects were pain at injection site, tiredness, headache, muscle pain, chill, joint pain, and fever. There are other side effects. There were 4 patients who developed Bell palsy, which is temporary paralyzed in the facial muscles. There were also 2 receivers that got a severe allergic reactions. For Moderna, the common side effects were the same as Pfizer, but they only reported to have 3 patients who had received the vaccines develop Bell palsy. Since the safety data is limited, there is a plan established to manage allergic reactions occur following administrations of an mRNA COVID-19 vaccines. Vaccines providers should observe patients for about 30 minutes if the patient have history of anaphylaxis of any kind. All other patients should be observed for about 15 minutes after vaccination to monitor for occurrence of immediate adverse reaction. A person who is determined to have a severe allergic reactions after the first dose should not receive the second dose. Here is a table showing ingredients included in Pfizer-BioNTech and Moderna mRNA COVID vaccines. Please take a look and see if you have any allergy to any of these ingredients. If you have a concern, please consult your healthcare provider and discuss your allergy with your primary care before receiving the vaccine. Now, one of the most important and what a lot of us wanted to know is how effective these vaccines are. Please keep in mind that these numbers came from preliminary data. The safety and the effectiveness of these vaccines are still being monitored. These COVID-19 vaccines are available for use in the United States by approval emergency use authorizations. mRNA vaccines have held to the same standard as all the other types of vaccines in the United States. But what we know so far is for the Pfizer-BioNTech, it has a 95% efficacy, and for the Moderna, it has 94% efficacy. Facts. Facts number 1 is getting a COVID-19 vaccine will not cause you to have a positive test results on COVID-19 molecular tests. The RT-PCR is a method used to perform COVID-19 tests which indicate a current infection if the patient tested positive. I will have a video coming up soon about COVID-19 testing. Stay tuned. Facts number 2. Safety data is not available for receiving COVID-19 vaccines together with other vaccines yet. So, the recommendation is to have the COVID-19 vaccines 14 days apart, whether it will be 14 days before or 14 days after other vaccines. Facts number 3. People who have gotten sick with COVID-19 may still benefit from getting vaccinated. We do not know how long someone is protected from getting reinfected after recovering from COVID-19. And individuals who have gotten sick before may get vaccinated 90 days after recover. Thank you for staying with me until the end. What do you want to know next? Do you want to know more about blood bank, chemistry, microbiology? If you have any burning questions, please feel free to leave me a comment down below. Lastly, if you have not done so, please like, share, subscribe, and click the notification bell. I will see you in the next episode of Blood Talks. And as always, remember, your blood tells you the story of your health. Thanks for watching. Bye!